Hi, everybody. Um, Going on with this schedule, I'm Cynthia Belangeiro, professor of human genetics of this medical school. And I'm pretty proud to be part of this meeting with outstanding people from the whole world. And I'd like to congratulate Dr. Jair and his brilliant team for coming through this idea. It's my pleasure to introduce Dr. Guilherme Polanczyk. He's professor of Psychiatry Institute of University of São Paulo. Dr. Guilherme, please.
Thank you. Good morning. I also would like to thank Jair and all the organizing committee for the invitation, for the opportunity to talk to you about our National Institute of Developmental Psychiatry for Children and Adolescents. Also, congratulations, Jair, and all the people who are organizing this wonderful meeting. It's really, really amazing what you have put together. My mission here will be to talk to you about this institute, which is formed by the Universidade de São Paulo, Universidade Federal de São Paulo, Universidade Federal do Rio Grande do Sul. Several of you who are here are members of this institute, and we'll see your data here. So I will. It's not working. The outline of this brief talk will be the motives, the background behind the organization and then the conceptualization of this program, of this research program, our goals. I will show you a little bit, a brief overview of our research agenda. You'll see that it's very broad, so I'll have time to touch on some of our projects, our first results, and where we are going, our next steps. In terms of the background, what was in the coordinator's mind when this research program was conceptualized was first that I'm sorry, this is not working, but 3/4 of adult patients with mental disorders have a juvenile history of that disorders. And this data is supported by data from the National Comorbidity Survey replication in adults, which shows that half of all lifetime cases start by age 14 and three-fourths by age 24. This means that adult psychiatric disorders begin early in life, begin in childhood and adolescence. It was also in the coordinator's mind what this picture shows. Medications with distinct mechanism of actions for depression in blue, schizophrenia in this orange, and heart disease in light blue. In 1950, you see that for these three disorders, we had a equivalent number of distinct medications with distinct mechanism of actions. In the following 15 years, in the present moment, what we have is virtually the same number of medications with distinct mechanism of actions for treating psychiatric disorders in comparison, for example, with heart disease. New medications are very rare. And our medications, we know that relieve symptoms. We have a pretty, for some disorders, we have a pretty good remission rate. But what we have is, in most of cases, persistence across development, across time. And new episodes and so on. In parallel with that, what we saw in the last 30 years is a rising rate of randomized control trials focused on preventive strategies. This is to where the scientific community is turning their attention, probably for several different reasons, but because our treatments are partially efficacious. But to develop really effective preventive strategies, we have several challenges behind just delineating the program. First, we need to understand and know and identify who will be the cases the cases that will be targeted. We will have universal strategies. What this picture shows is what happens in psychiatry, that we have actually multiple risk pathways that lead actually to the same disorder, and different disorders sharing the same risk pathways, the same risk pathways. This challenge even more our preventive strategies. What we need to do in order to prevent or to aim to prevent adult psychiatric cases is for some disorders to start early in adolescence, but for several disorders to start even early in infancy. What we have in infancy, in childhood or infancy, are markers of risk that we need to better understand. Another background, another motivation for this research program is the scenario of academic child and adolescent psychiatry in Brazil in the past years. As you certainly all know, child and adolescent psychiatry is a new and emergent field across the globe, and in Brazil also is the case. So we have small numbers of academic centers doing research and producing new data. Most of them centered on South and Southeast. In terms of number, for example, of child and adolescent psychiatry, we have no more than 500 professionals, trained professionals across the country, which is clearly insufficient. So the goals of this research program, first, to contribute to the development of the field of academic child and adolescent psychiatry in Brazil, and to disseminate the perspective of developmental psychiatry. To use the perspectives of developmental psychiatry in training professionals, not only residents, but also general practitioners, teachers, school teachers, and other professionals who can benefit of our knowledge. And to develop a platform of research projects addressing childhood mental disorders from a developmental perspective. These are the broad goals of this research program. These three universities who centered the project got together with other universities from Brazil, with other universities and international collaborators from abroad, and developed the research program, which originally consisted of 16 research projects. These projects were these programs were centered in research, so we have experimental and observational studies, an educational module, knowledge transference module. And I will present some of the projects to you. The first project that I'd like to present is the high-risk cohort study for the development of childhood psychiatric disorders. Behind this project is the idea that we need to identify a consistent set of risk markers that precede the development of the disorder. So to aim in this, with this aim, 10,000 families were screened at schools in São Paulo and Porto Alegre. From these 10,000 families screened, we have family history for 45,000 family members. And among these 10,000 families, which represents 10,000 children, we randomly selected 1,000 of them, and 1,500 of them were selected because they had the highest probability of a mental disorder at the moment, based on family history and symptoms at that moment. These 2,500 children and families were interviewed. So this is the distribution of their homes in São Paulo and in Porto Alegre. We visited them at their homes and at their schools and collected a number of measures of risk factors, measure of psychopathology of the child, of the mother, and also we had DNA from all this, from all the sample, and MRI from 750 children. This study had a baseline phase, which is already completed, and we are about to start the 3 years follow-up. In terms of results, this is the prevalence of mental disorders. So any mental disorders, we have 26% of the sample affected by one of the disorder, which is significantly higher in the selected, in the high-risk subsample. So we have all mental disorders assessed, and for all these, for each one of these mental disorders, we have a research group focused, interested in that research, in that specific disorder, and working on that. These are some of the results. This is the first study probably published from resulting from this sample. Leading author is Giovanni Salum, analyzing threat bias in attention orienting in distress-related disorders and fear-related disorders, showing that in distress-related disorders, children have a bias towards the threat, and in fear-related disorders, children had a bias against or in opposite direction to the threats. Other results are this study. Fernanda Krieger is the first author working with ODD in this sample and showing that ODD has in our sample 3 dimensions, which is pretty consistent with previous results, and showing different correlates, family history and other symptoms of the child, and other correlates for different correlates for each one of these dimensions, supporting the idea that we have within the ODD diagnostic, we have probably a high heterogeneity, and which will lead to different disorders over time. Another study is Pedro's study, which was submitted, studying mania-like symptoms dimensions and showing the dimensions within the mania that has been showed in other samples. For this 2,500 children, we have genotyped a series of polymorphism. This is a work by Elena Brentani, and based on some mental processes which will be analyzed. Also, Rodrigues Bressan group worked with neuroimaging, and we have 4 different techniques for these 750 children assessed with these techniques, and also we have blood for this subsample. Another study, also a longitudinal study, which we understand will inform us, will give us data to meet our goals in terms of understanding risk pathways to mental disorders in adolescence and adulthood, is a birth cohort. Actually, women are selected during the 3rd trimester of her pregnancy in an area in São Paulo. So this is based on community centers, healthcare centers. We have already included 938 pregnant women, and we are following them. Their children will be followed very shortly during the first 3 years of life. We are just collecting data on all kinds of exposures to environmental risk factors, protective factors, and all sorts of risks and outcomes that we at the moment understand that can be interesting in future analysis. We also have blood cord collection for these women, and Elena Brentani also is studying methylation patterns based on exposures to their mothers during the pregnancy. These are the 2 longitudinal studies in our research program. We have a survey. In Brazil, we had data from very specific areas on mental health, on childhood mental health, just south, southeast, and very limited studies conducted in other areas. So we aim to assess in a survey the mental health of children. So 4 cities in different areas of Brazil, north, northeast, center, and southeast, were selected, and 2,000 children were evaluated in each one of the cities, aiming to understand social, or to explore the influence of social and cultural factors in relation to the expression of psychopathology, comparing these 4 different cities. What we have is also very preliminary data showing that 15% of the sample has a mental disorder, and it's not presented here, but urbanicity and other factors related are strongly related to mental disorders in these 4 studies. In terms of clinical studies, based on the idea that the disorders that we treat are in general chronic, and that we need several different strategies, treatment strategies, to treat them effectively. And this is very, very true for several childhood mental disorders, including OCD, which in some cases does not progress, but in several others actually progress to chronic and to adult OCD. In this study, we aim to assess the best order of treatment when we have a child with OCD. So this is also in progress. Roseli Chavich is the leading the PI of this study. We have 100 children already randomized to different orders of treatment. So a child can be either randomized to group therapy, to group CBT, or to fluoxetine, and based on their response to this initial treatment, they are further randomized either to another treatment or either to an add-on strategy. And we believe, although it's a complex study design, we believe that this kind of study design can inform our practice much more efficiently than just ordinary or parallel randomized controlled trials. We have a focus also on training family doctors and school teachers. So we have developed a platform via web-based to train school teachers on how to identify and manage childhood mental disorders with different strategies, web conference, we have a discussion forum, videos, and paper material. In terms of education, we have more than 70 students with scholarships in different universities who are working with the data that we are generating. And 19 international researchers in Brazil have come to Brazil in the past 3 years in the context of collaborations and also courses for PhD students. 6 new courses broadcasted across universities in the theme. Our next steps. New projects also, the result of projects are usually new questions and not answers, but that's how it's turning to be. So we are following up initial projects and organizing new projects with new collaborations, supporting the continuity of longitudinal studies, which is a challenge in terms of the high costs that these studies have, and also a not clear understanding from the funding agencies that results come with time, because our outcomes are a result of the development. Of course, we have a time lag from the starting of these cohorts to the publication of data, and this is a barrier to continuing support, and also a challenge to communicate with policymakers. Our idea is to produce new knowledge that can be useful to clinical settings and also to public settings. And this is a true barrier, or a true challenge that we need to evolve in terms of communicating with policymakers. This is one among several other research projects resulting or as a consequence of this research program. This is funded by USP and focused on the 5 first years of life, and the idea is to focus on new interventions that can be done early in this stage. One of these projects is the nurse-family partnership developed by David Olds and tested by him, which we are probably implementing in the near future. This is a prenatal and infancy home visiting by nurses focused on low-income mothers with no previous live births. Activates and supports parents' instincts to protect their children, and there is a very clear methods and goals behind them. They have basically 3 goals: to improve the pregnancy outcomes, the child health and development, and parents' economic self-sufficiency. There are good data showing the efficacy of this intervention. For example, this data showing reduce of child abuse and neglect in those children whose mothers were visited during pregnancy. And there are other interesting and promising results. Because in our understanding, we probably have a greater effect on preventing mental disorders if multiple interventions in multiple levels are implemented, and we believe that in all different levels of the pathway that lead to psychopathology, interventions are necessary. This is some of the researchers who are part of the NPD. Euripides is the coordinator, Luiz Augusto Rode is the vice coordinator, and our PIs. And this is our website, which I invite you to visit. Thank you for your attention.
Thank you, Dr. Guilherme, for your brilliant presentation. And we have time for a couple questions.
I was wondering if you offer any kind of support to the mothers with these visits from the nurse. Do you evaluate depression on mothers and offer treatment?
Initial results on this program haven't included mental health outcomes on that. We have criminality from children, but that's it. And our idea is actually exactly what you are touching upon, to include mental health outcomes on that. So yes, we'll be assessing that.
Treated as well?
Sorry?
Once assessed, they will be treated? If will you offer treatment? Can you offer treatment to all these?
Sure, all these women are in a catchment area where they have access to medical treatment. So yes, they are in UBSs. They are served by UBSs.
Hi, congratulations. This is amazing. Great to hear that this is all happening. I have a question because I share your concern about how to support longitudinal studies, and I think this is the next very, very much necessary step if you really want to understand pathways south of the equator. And so I'd like just to hear from you, what are your ideas of what could be possible? Because I really share your concern. I think this is very necessary and the challenges are immense. And congratulations again for the work.
I think there are different research agencies. Some of them is possible to be in contact with and are more open to support this kind of study, ongoing study, with and which they understand that the results will come later, but probably will be much more interesting that results coming from cross-sectional studies, if we are if we are interested in these kind of questions. I would say. Actually, probably several of our researchers here have much more experience with the research agencies in Brazil, and maybe you could comment on that. I don't know if. Can help me? Yeah.
May I just add something? We have had some success in trying to think about the longitudinal cohort that we sample based on social risks, which usually are of interest to agencies. So that could be one idea. And another thing is something that Dr. Wiseman mentioned this morning, for example, that in her sample of depressed individuals, they have a higher risk of, for example, cardiovascular disease. So if we establish cohorts that could be of interest to people in other areas of health, that can also help to keep the cohort, and we're doing that with some of our cohorts there as well. So just a few ideas, because I think it's a huge challenge worldwide, and we will need all smart decisions and strategies to be able to deal with it.
Thank you.
Thank you, Guilherme. I think this was a very good idea to show, this more deep and coordinated work, all the universities of Brazil working together in this project. So it was a great idea. And this is a special grant of the Brazilian agencies. So in some ways, it's better to try these grants than to try for the bureaucracy of trying to get funding from other countries. In our case, for instance, we have an agreement with Norwegian government, and for the Brazilian bureaucracy, it's really hard to use the money. So it's much easier for us when we get a good Brazilian funding, and then we have been able to put together, as you know, can imagine 70 students doing post-graduation in this whole project, you know, and also it's a sort of, we can advertise people, you know, we would like to have more people putting projects together, bringing more people to study. And here I have to say, you know, we are very sad with somebody who we lost during this way. We had Dr. Marcos Mercadante, who was the main link with our university, Rodrigo and Marcos, but Marcos was the child psychiatrist, and so he passed, and he left. He, unfortunately, very young guy, very bright, very charming, and very active. And so we are here also, you know, because his ideas were really good. And but anyway, it's important to wherever we can find money is good, you know. So Brazilians also, we have to try more international agencies. But we have, what happened in psychiatry is that we got in a certain level that we have been able to compete with other fields and to get these best grants, particularly because, you know, getting together most of these people, these Brazilian rising stars who are here, like Kripa, you, Euripides, Rodi, Rodrigo, and many others that have been very active, and we work in such harmony that it's possible to put things together. And but anyway, we are where we have to do for more cohorts, more money, you know, to improve our quality. So we want to get in the nature, in the science. We still have a long way to go.
Thank you very much, Dr. Guilherme.